I hope the meetings in the Windy City are going well, and I'm sorry I can't be there with you today, but I do want to thank the World Council of Optometry for giving me the opportunity to speak to you today. And in the audience, I hope, are some colleagues of mine, people like Brian Holden and Kovin Naidu, Bob Chappell. I'm sure if there's any questions that come out with what I'm about to say, I'm sure they can answer them for me. So who am I? Let me start by telling you who I am. Well, I'm Peter Ackland, and I'm the Chief Executive Officer of the International Agency for the Prevention of Blindness, IAPB for short. And IAPB is a membership organisation, 120 members, all the big international eye health NGOs, not-for-profits, the professional bodies, they're all our members, including the World Council of Optometry. And we're mainly involved in advocacy work and spreading awareness about issues to do with eye health and visual impairment, optometry and ophthalmology. In 1999, the IAPB, together with the World Health Organization, launched the Vision 2020 initiative. And this was designed to eliminate avoidable blindness by the year 2020. And that's what I want to talk to you about particularly today, but with a specific focus on optometry and how important the whole area of uncorrected refractive error is in the work we do to eliminate avoidable blindness. Today I really want to talk to you about three main things. The first is the prevalence of uncorrected refractive error and the impact it has on people's lives and society. The second thing I want to talk about is what needs to be done. And the third thing is what you as individuals could do to help. So let me start by the first of these, the prevalence of uncorrected refractive error and the impact that it has. So according to data published in 2008, which was looking at what the situation was in 2004, a very important paper by someone called Serge Rezhnikov and others at the World Health Organization. There were a total of 153 million people in the world who had some sort of disabling visual impairment simply because they had a refractive error that hadn't been properly corrected. Maybe they'd never been for an eye test, maybe they'd never been able to access spectacles, but for whatever reason, these were people who were seriously impaired visually, basically for the want of spectacles. I'm going to say that number again because it's such a big number and it's easy to sort of forget how big it is. 153 million. That's around 2 to 2.5% of the world's population. So we're talking about a really significant problem. Now, of that number, 8 million people were blind. And by blind, I'm using the sort of WHO recognised criteria. So this is people less than 360 on the Snellen chart. 145 million were low vision, somewhere between 360 and 618. So people who've got a serious, whose visual impairment is disabling. But this was only referring to distance vision problems, myopia, hyperopia, astigmatism. What it did not include was an enormous number of other people who have a near vision problem, presbyopia, for example, and that was also uncorrected. In 2009, some more data was produced which focused on just those people who had a near vision problem. And this was published by Holden and others. And it came up with a figure of just over 500 million, 517 million who were uncorrected for near vision, presbyopia. And the other thing they found out was that in low income countries, on average, only about 1 in 4 people had access to spectacles and examinations for people with near vision problems. In some of the poorest countries, it was as low as 1 in 16 of the community had access. So this is a huge problem. If you add the two numbers together, you get something around the 700 million people mark. That's 10% of the world's population who have basically a problem with vision simply because they're not getting a proper eye examination and proper refraction and spectacles. When I first heard this figure, I mean, I was astounded. I think, how can it possibly be that 10% of the world's population has got this issue? It's not as if the technology is latest cutting edge. As this first image shows, glasses have been around for an awful long time. This figure is showing some paintings from the Italian Renaissance in the 13th century. Clearly people were wearing spectacles at this time. This is a very Eurocentric historical view, and if you were to go to the Middle East and China, you'd have found people wearing spectacles, eyeglasses, probably 3 or 4 centuries even before this. So it's something that we can do something about, and I believe something we should do something about. It's a question of human rights as well. A typical situation in Africa. This is this second image is the picture of a gentleman in Tanzania, and what you can see here is this gentleman originally would have had a cataract operation, and he's been given the big +10s immediately after his operation, which probably enabled him to see quite well soon after that, but clearly he's never had another pair since then. And obviously, as you all know, if you have a cataract operation without the lens implant and you rely on spectacles like this, then you're not going to be seeing very well. So these are the sorts of problems that arise. But why? How can it be that 10% of the world's population is in this position? Lack of awareness, both at individual level, at family level, at community level, and amongst health policy makers, is certainly a major factor. The non-availability of refractive services is another chief cause. As I mentioned, in some of the lower income countries, the coverage is extremely low. Insufficient provision of affordable spectacles. In many countries, of course, if one can afford it, one can find a pair of spectacles and get a proper exam, but often the prices are way out of reach of the vast majority of the community. And there are also cultural disincentives. People don't necessarily like wearing spectacles. In some countries, it's an indication of sort of, poor, some sort of defect, which has a negative impact on women's opportunities to marry and things like this. So in many countries, this sort of myriad of problems or causes give rise to the overall numbers that we see. So the impact of all this is huge. On the individual, for children, approximately 13 million of the numbers I said are children. So these are children less than 15 years of age who've got some sort of serious problem for the want of a proper pair of specs. And what we know is that probably 90% of children who are either blind or severely vision impaired won't be in school, or if they are in school, they're certainly underperforming. Most won't be there at all. So most children who've got this sort of condition will not be attaining the sort of levels of education that their peers will, and probably won't be in school at all. This leads obviously for a whole lifetime of lost opportunity for them. For older people, people might lose their jobs if they can't see so well. Their employers are not going to basically keep them on, so they lose employment opportunities. Even in the domestic level, as people get older, important household functions like cleaning rice, seeing the bits in the rice that you don't want to eat, sewing, these sort of domestic tasks which a lot of women are responsible for in many countries, their inability to do that has a negative impact on the rest of the family. Other members of the family have to take over those roles, which means they can't be earning an income. So all this adds up to a huge amount of lost opportunity for these individuals, losses of employment, losses of income, and it sort of spirals people and their families into poverty, which exists for a lifetime. And in 2009, Smith, Hull, Frick and Holden tried to put an economic value on the loss of all this income and potential earnings. And they came up with just the distance vision. This isn't the presbyopia, so just the 153 million with a distance vision problem. They came up with a figure of $269 billion a year in terms of lost productivity and social costs. So what we're talking about here are big numbers. 153 million people affected and a cost in terms of economic cost of $269 billion a year, lost productivity. So this is a huge issue. It's something we should be and can do something about. And the sums add up. When I'm going to move on now to what we need to do about it, but there's a paper about to be produced in the next few months which will estimate what the costs are of now solving this problem. But what we know is it's going to be a fraction of the total cost that's been lost. Let me just close this first section by also saying that the problem is actually going to get worse unless we do something about it. In the year 2000, there were about 600 million people globally who were over the age of 60. By the year 2050, that number will have more than trebled and become 2 billion. And as we all know, most of these problems crop up as people get older. So the ageing population of the world is going to potentially hugely increase these numbers over the next 2 or 3 decades. And the other major factor is the sort of explosion in myopia. And as I'm sure most of you in the audience are aware, in places like urban China, Southeast Asia, teenage children, 70 to 80% recorded myopia. So if that trend continues, together with the global ageing at the other end of the age scale, the numbers that we've been talking about are only going to get bigger unless something is done to solve the problems. I now want to sort of move on to what the solutions are and what we can do. Now, since Vision 2020 started in 1999, we've done an awful lot of work to try and A, establish the extent of the problem, but B, more importantly, find some solutions. And basically what we know is that there are 5 things that we could do which would essentially solve this problem. Timescale, if we really implemented them now in a serious way, probably within 10 or 15 more years, we could largely have solved this problem going forward. So the first thing we need to do is to massively scale up the optometry services that exist already and make them particularly available into rural communities in the developing countries. And there's been a hugely successful model that's been established in India. It's now spreading across much of India and is also being used in some other neighbouring countries. And it's a model which is based on what we call vision centres. So a vision centre is staffed by an ophthalmic technician, somebody who's been trained, maybe 3-6 months, it depends a bit where you go, but basically what they can do is they can certainly do refraction, they can identify somebody with other causes of poor eye health and refer them to a hospital or another centre for further treatment. But for all those patients who present with a refractive problem and who need spectacles, they are able to identify that, give them the proper refraction, and provide them with spectacles. one of the uniquenesses of this model is that the spectacles can be provided by the same centre that does the refraction. They may have to wait a day or two, but not very long, and these vision centres are based in their community. Typically they serve a community of about 50,000 people, which in places like India, in a high density area, is a very small community. So people can go locally, they can get what they need and at an affordable price. So a rolling out of the vision centre model is something which we see as a key to success going forward, and we believe that it can serve the needs of many of the world's poorer communities. The second thing that needs to be done is to provide these refractive services at the community level, and particularly in the poorer, rural and underserved city urban areas. Spectacles have to be provided at a price that local community can afford. There's been various attempts to do this, and what we do know is that with a proper pricing structure and enough throughput, most of these vision centres can provide these spectacles at a cost and become self-sustainable. The money they get from selling the specs more than covers their costs. So at the base of the pyramid, at the services that are going in at the community level, it can be a sustainable financial service that doesn't need external inputs after the initial capital costs have been met. So this is a model which we think should be rolled out extensively. The third area is a major concentration on human resources. Presently, we think an additional 40 to 50,000 people globally need to be trained in providing optometry vision care. They don't all need to be at the level of optometrists. There have been various models developed in Africa, for example, where there's different levels. People come to do a 2-year course and become a sort of optical technician, and then some of them can go on the full 4 years and become optometrists. But about 40 to 50,000 people globally required to be trained and able to give vision care. Another 18, 20,000 or so need to be trained to be able to provide the spectacles, so the dispensing side of it, and make and prepare spectacles. So there is a big training need, but it's not just about training, it's also making sure that once trained, those people go into a system which supports them. So there are policy issues around making sure that they are retained within the workforce, that their role and their post is recognised by government or others, and that there are incentives for people to work in the rural areas, which is where often the main problems are, and things like that. So a lot needs to be focused on human resources, but there are many good examples. And one of the leading agencies, one of our members, the International Centre for Eye Care Education, has done a huge amount of work to come up with syllabuses and curriculum that cover all the training needs, and to come up with distance learning packs so that people can be supported in that way as well. So this is an area which needs, again, scaling up, but where what you need to do is well known. A fourth area is expanding school screening. So all children in school should be screened, probably at the end of primary, beginning of secondary school, and again later on, to make sure that they don't have some sort of refractive error problem. This can be done in a very simple screening, can be done by school teachers, who can then refer children in their classes who they think may have a problem to someone who can come in and do a proper refraction and assessment. One of the things that we're trying to do at the moment is to interest the World Bank in this. The World Bank supports quite a lot of school health programs around the world, and currently school health projects in most developing countries don't include an eye health component. but we're talking to them, and in some countries we're going to be piloting the inclusion of this screening for children with eye problems in these programs. And if we can do that, that obviously brings in a huge more new source of resources to help fund the work. And again, in various countries there are models where teachers have been trained to be able to do this, and it's worked very well at low cost. The key thing, of course, is also to be able to provide the children with the spectacles they need. Doing the screening but then not being able to provide the spectacles is obviously not much good for anyone. And the final thing that we could do relatively straightforwardly is we need to nurture and develop either a local optical industry which can provide the necessary spectacles and equipment that we need to run these refraction services, or import them from other sources if needed. And there's been a huge amount of work gone on to identify high quality but low cost lenses and frames which can be provided, and there are various resource centres. There's one in Durban, there's another one in Hong Kong. There's an IAPB list of equipment where you can find all these manufacturers who can basically provide any service with good, high quality but affordable, low cost spectacals. So either building up the local industry to provide things, or using these low cost alternatives is the fifth dimension that we need to do to scale up to achieve the resolve of this problem. The final part of my talk is to talk to you about what you can do to help individually. The first thing, of course, is to help raise awareness and become an advocate. I meet so many people who are, just amazed when they hear the scale and the size of the problem, and even more alarmed that when they hear, well, actually this is something we could do something about, but nobody seems very interested. So one of the things IAPB hopes to do, together with some of the member organisations, is to run a campaign over the next 5 years to really raise awareness of this as a public health issue. And it'd be great if you as individuals or your practice or people you know could sign up and become part of that campaign. Spread the word to people you know. I guess many of you will have influence in terms of policy makers, and there'll be some of your patients may even be in a position to do something about this. So it's just making people aware that this is a problem and there's something we can do something about. So a big campaign which hopefully there'll be ways that will interest you and that you could become involved. A second thing that you could do personally is you could volunteer with one of the several organisations that send volunteers to developing countries to help provide optometry services. So this could be doing the refraction and prescribing spectacles, but probably more sustainable and more useful is things like going to some of the schools of optometry, having a permanent relationship, and maybe doing lectures and training and things like that. Another thing could be to use your business skills in helping, say, a vision centre make sure that its business model is sustainable and the finances work and the systems all operate. So there are various things that one can do, and invariably it's best to join an association which sort of nurtures a longer term relationship. Going into somewhere maybe once and then coming back a couple of weeks there is useful, but perhaps it's not as useful as if you establish a long-term partnership and relationship with that group. And the third thing that you could do as an individual is that you could support optometry giving sight. And this third image tells you a little about what optometry giving sight does. So this was a fundraising vehicle which was set up by the International Centre for Eye Care Education, IC, the World Optometry Foundation and the IAPB several years ago, with an aim of raising funds from the optometry profession and their patients to do good work. So basically OGS, Optometry Giving Site, exists in the States, in Canada, in various places in Europe and the Far East, and basically it's groups of optometrists who would like to help contribute to the development of all the things we've been talking about. So the ways they support are through projects, so they spend quite a lot of money invested in establishing these vision centres, the initial establishment costs of the vision centres, the training of the personnel that I've talked about, and also making sure that services reach out into the very poorest communities. So the Optometry Giving Site is something that either you could join and become a part of and donate to. Maybe your patients might be interested when they buy a pair of specs to pay an extra $1 or $2 and make a donation to an Optometry Giving Site. But certainly this is one vehicle which we hope will help raise some of the funds in order to do the scale up that I've been talking about. So those are the three areas where you could help as an individual. So finally, I just wanted to conclude by summarising some of the main points. And thank you again for your time and for listening. So the three key messages, I suppose, is that uncorrected refractive error is a massive global problem. It affects 10% of the world's population in one way or another, and is costing the world huge amount of money, $269 billion a year. Second point, we can solve this problem. We know what needs to be done. There are 5 key things we need to do, and if we did them over the next 10 to 15 years, we could solve this problem. We also know that the cost of doing that is a fraction of how much money is being lost. And the third thing is that you, as an individual, can help. The worst thing of all would be for you just to leave this presentation at the end of it and say, oh, well, that was interesting, and then go off to the next session. But if you personally get involved and can help contribute to our campaign, our awareness campaign and our fundraising campaign, you could make a huge difference on the lives of many people. Thank you.